Madeline. What brings you to the office today?
This is just my yearly checkup.
Okay, that's great. We can get that going for you. Before we get started, I have some questions, all right?
Okay.
The first thing I want to talk to you about is your past medical history. So I'll ask you some questions and you let me know what you know, okay?
Alright.
So describe your general health.
I'd say I'm pretty healthy.
You're pretty healthy? That's wonderful. Do you have any major conditions that you're dealing with right now?
No, nothing I can think of.
Nothing. Okay, good. Did you have any childhood illnesses, Madeline?
No, I mean like the occasional strep throat, but that's it.
Strep throat. Okay. Do you have anything going on right now? Any major conditions presently?
No,
Nothing happening. All right. Do you have any allergies?
no allergies.
I asked if you had any major conditions presently 2 times.
Yeah, that's okay.
Okay. So Madeline, what medications do you take?
Just like a daily multivitamin.
Daily multivitamin. All right. And in the past, have you had any injuries or hospitalizations?
No,
You have not. That's good. Let me ask you this. Are you up to date on your immunizations?
I am, except I need the flu vaccine today.
Flu vaccine. Okay, we can do that for you. And in regard to your psychiatric health, do you have any mental health issues or concerns?
No, no concerns.
Do you have any past mental health history?
No, I don't think so.
All right, so that's good. So the next thing I'm going to ask you about is your family history. If you don't know the answers, that's fine.
All right.
What you do know, I want you to be sure to let me know.
Okay,
And this is just so we can kind of know what your risk factors are, okay?
that makes sense.
So this is about your immediate family only, not your second, cousins, uncles, brother-in-law.
Okay.
Just your immediate family. So has anyone in your immediate family had hypertension, stroke, heart attack, or any circulatory issues?
My grandfather had a heart issue.
Your grandfather had a heart issue. Do you know if he had a heart attack?
Yes, he did have a heart attack.
Granddad, heart attack. Did he have high blood pressure?
He did.
Okay. How about neurological conditions like MS or headaches?
Not in the immediate family. I mean, headaches in the immediate family, but not MS.
Okay, headaches.
Nothing else other than that.
All right, so let me ask you a few more things about your family. So I'm looking to know if anyone had diabetes,
No,
kidney disease.
no.
How about allergies or asthma?
My sister has asthma.
Your sister has asthma? Okay, so we'll make a note of that too. What about thyroid disease?
My grandmother has thyroid
Your
disease.
grandmother on your mom's side? Or
On
your
my
dad-
mom's side.
Grandma on
And
mom's
then
side.
the heart attack was my grandfather on my dad's side.
I was just about to clarify that. Thank you so much.
No problem.
Okay, so what about any mental illness history?
None.
Nothing like that. Any substance abuse?
No.
Okay, no and no. And are all the members of your immediate family alive?
Yes. Except for my dad's mother, my grandmother. She just passed away.
One grandmother. Okay, and what did she pass away from?
She had cancer, breast cancer.
That's your paternal grandma?
Yes.
Breast cancer.
Mhm.
Okay, excellent. So the next thing I'm going to ask you is your social history, just a little bit about your lifestyle. You'll see. Simple questions, nothing to be scared of, okay?
Okay.
So where were you born?
I was born in Easley, South Carolina.
Okay, right here in the U.S., not out of the country.
Right.
Okay, was it a routine birth?
It was.
Okay. And were you raised in a 2-parent home?
I was. Yes.
You were. Okay, and that was good? No
problems.
no problems, okay. And what do you do for work?
I'm a full-time student. I'm an RA on my campus.
Fantastic. What kind of student are you?
I'm a nursing student.
You're a nursing student.
Yep.
I'm so happy to hear that. Think you're making the right choice. So where do you live right now?
I live in Rhode Island.
You live in Rhode Island. Do you live with your parents?
I don't. I live on campus.
You live on campus. Okay. So in your present situation living on campus, do you feel safe?
Yes.
You do. In regards to your income, I know you're a student, but do you feel like all of your needs are met?
Yeah.
Okay.
I have a good support system.
You do. That's one of my questions as well. Do you
Did
feel
not
that you
know
have a
that.
good support system?
I do.
Yeah. Alrighty. And how would you describe your diet?
It's a diet. I would say it's pretty good.
Typical college
Yeah.
kid diet. Okay. But you no extreme
Nothing.
dieting,
No.
nothing like that. Alright. Do you exercise?
Yes, I'm pretty active. I walk on campus. It's like, yeah.
Okay. Like you walk as exercise or you walk as part of your job?
Both.
That's excellent. Walking is great for you. So, this is a hard question for college kids. Do your best with it, but how many hours a night do you sleep?
6 or 7.
Oh, that's really good. Okay.
Hopefully.
That's good.
Yeah.
And are you sexually active presently?
Yes.
You are. Okay. That's excellent. So we can talk about that. How about drugs or alcohol? Any drugs or alcohol?
No.
No drugs, no alcohol. And my last question here, what sort of support system do you have?
I have
You already
a
answered.
great support
Let
system.
me ask you one more thing. What are your religious practices?
I'm Catholic.
You're Catholic? Are you practicing Catholic?
I try to be. I pray often, but I don't really go to church.
Okay. You active in your campus ministry?
Yes.
Fantastic. That's probably part of your support system. Wonderful. All right, so here's some questions about your body that I want you to answer subjectively, okay? So, you already told me that you're generally in good health, but how do you feel generally?
I feel healthy.
You
I feel
feel
fine.
good. You do. Do you have any weight loss or change in appetite?
No.
How's your energy level?
Pretty energetic, except for those nights when I don't get enough sleep.
Okay, that's excellent. What about your skin? Any rashes or changes?
Nothing that's changed.
And you haven't noticed any changes in moles? Nothing like that?
Mm-mm.
Okay, fantastic.
Just stress acne.
Okay, so we're going to talk about everything that's going on up here. In regard to your vision, how is your vision?
That's good.
Okay, do you wear glasses?
No, I got perfect vision.
Perfect vision. All right, well, we all wish we had that. Do you have any tearing, watering, or blurring?
Mm-mm.
Your eyes? No. And your hearing, is there any fullness or ringing?
No.
Do you generally hear well in school?
Yeah.
You hear everything. Okay, are you ever dizzy?
No.
Not dizzy. Excellent. So in regard to your nose, any nosebleeds?
Mm-mm.
Any stuffiness?
No, I've only ever had like one nosebleed in my life.
Okay.
So.
Probably not an issue at all. Do you have postnasal drip?
No.
You do not. All right. So we'll go down to your mouth and your throat. All your teeth yours?
Yes.
Okay. Well, they have a beautiful smile too.
Thank you.
Any dental problems?
No.
Okay. Do your gums bleed when you brush?
Mm-mm.
They do not. In regard to your throat, is it ever sore?
Not normally.
Okay, only when you have like a cold or something.
Yeah.
Yeah. Fantastic. Difficulty swallowing?
No.
Is your neck stiff?
No.
Painful? No. So, do you have any tenderness or lumps?
Mm-mm.
How about swallowing? Can you swallow okay?
Mhm.
Excellent. Because you're young. No problems, right? Okay.
Hopefully.
So, talk about your cardiovascular system. Ever have any chest pain, palpitations? Does your chest raise? Like your heart race?
No.
Does not. And so we all feel that a little bit when we get anxiety.
Yeah.
But you're saying no. Okay. Are your extremities cold?
No.
They're not. All right. In regard to your respiratory system, do you ever get short of breath?
No.
You do not. How about coughing or wheezing? Well, your sister has asthma. Have you
Yeah,
ever had those?
But I've never had those symptoms.
You have not. Very good. So we'll talk about your belly now. Any troubles with digestion?
Not really.
Okay. And your bowels are good? Any changes? No change in your habits?
No.
Okay. Do you have any like cramping or pain when you go?
Mm-mm.
Don't. Any gas?
No.
Indigestion? Brushing? No more than the usual?
Right.
Okay. Any food intolerances?
Mm-mm.
No. Okay.
Sorry.
A lot of people have at least, food intolerance there, but that's excellent. So, how about urination? Any burning or frequency?
Mm-mm.
Have you ever had a UTI?
Maybe once ever.
Okay, but you're not experiencing that now.
No.
All right, you're able to get to the bathroom on time. You never had any incontinence issues.
Yeah. Okay.
And when was your last period? You remember?
I have an IUD, so I don't really get a
Infrequently.
period. Yeah, last December.
IUD. Oh, a year ago. My goodness. Okay. So, what about muscle or joint pain?
No.
Do you have any limitations, or do you think you have a good full range of
I
motion?
have great range of motion.
Do you really? Okay. Wow, they're so confident.
I was
We're
a
gonna put you
gymnast.
through. Were you okay, amazing. Okay. So we'll talk about your neurological system. Do you ever have any numbness or tingling anywhere in your body?
No.
You don't experience that. Excellent. Have you ever fainted?
Like once when I was getting blood work done, but I think that was probably nerves.
Probably not. Okay, that's understandable. And what about, you said your family has headaches. Do you get headaches also?
I do.
You do. So what are your headaches like? Just describe them for me.
Normally it's like a full throbbing, and I have to take a nap and take an ibuprofen.
And a
or-
nap helps?
Yeah.
And how long do your headaches last?
If I don't take a nap, it's basically until I go to sleep. There's nothing really that helps other than that.
Okay.
It's just like a full reset.
What triggers your headaches?
Changes in the weather normally.
Weather. And how long have you had that?
As long as I can remember.
Always. Okay. Excellent. We got that. So, you said you had no mental health issues, but what about stress or anxiety? Do you ever?
School.
Yeah. Okay. And no difficulty concentrating. You're not like, okay. Fantastic. So, I'm going to ask you just a few last things, and you tell me yes or no if you suffer from any of the following. Swollen lymph node?
No.
Any sort of a bleeding disorder or anemic? Are you anemic?
I'm anemic.
You are. Yeah, that's pretty common in girls your age. It's a diet-related thing, or sometimes a menstrual thing, which may not be the case for you, but we can explore your diet. What about hormonal issues? Mood swings?
I used to get really bad mood swings, but I would probably say that was like
Kinda
teenage
steadied out now?
hormones. I'm okay.
Fantastic. All right. Well, I'll do your physical exam in a moment, okay?
Mhm.
You can this room.
Thank you.
Thank